Hi, it's Dr. Merrill, and today in Coach Classroom, we're going to tell you how to read a hearing test. The biggest thing about coming into an audiology practice is to know where your hearing is or your baseline hearing. So today we're going to teach you all about that graph. So if you see here, this is what we call an audiogram or your hearing test. It is a graph of hearing. So if you look at this, we're going to go, the top is very, very quiet sounds. The lower on the graph, the louder it has to be for you. If you look at the graph, all the way to the left is going to be your low pitches or your vowel sound, your volume of speech. All the way to the right is your higher pitches or your consonant sounds, your clarity of speech. As you can see with this color-coded graph, there are degrees of hearing loss. One of the questions we always get is how much percentage of loss do we have? Well, us as audiologists do not give percentages of loss because normal can range anywhere from -10 to 20 decibels. So there's not really an accurate 0 to 100 scale. So instead what we do is we do by degrees. So you have normal hearing, mild, moderate, moderately severe, severe, and profound. X's, usually found in blue, are your left ear. O's are your right ear. That shows your air thresholds, which show from how you get the sound from the outer ear to the middle ear, all the way to the nerve. And then you have brackets, as you can see in the corner key, little Pac-Man brackets that show you your bone conduction or your bone thresholds, which innervate the nerve specifically. So here are two examples of patients with hearing loss. As you can see from what I mentioned in the previous slide, X's are your left ear, O's are your right ear. They are about symmetrical. We actually like to see your ears symmetrical the way that they age progressively. We want to see them do that the same way. If you have a little bit of difference between the ears, sometimes that just happens. Sometimes there's a reason behind it. You had a hole in an eardrum, or you had chronic ear infections in one ear, but for the most part we like to see a symmetrical hearing loss. As you can see to the left, this patient has a mild to severe hearing loss in both of their ears, mild in the low pitches, and then it slopes to the severe in the higher pitches, and about the same in the one to the right. A little bit more hearing loss, but still pretty severe. In the right, you see what we call a speech banana. Those are your speech sounds that you hear and where they are in terms of pitches. As you can see on the one to the right, the lower pitches have all those bassy tones, and then you have the higher pitches. On the left kind of are just big sounds, how loud they are. As you can see, the airplane is all the way at the bottom at about 110, 120 decibels. That's a really loud sound. So from these X's and O's that are drawn in, anything above those lines, a patient cannot hear. So to the left, the patient's missing the clock ticking, the bird singing, the leaves rustling, and the patient to the right is also missing those sounds, but all of those speech sounds, the S's, the TH's, also the P's, the ch's, so that makes it harder to hear. So why do you have a difficult time hearing in background noise? So as you can see, another audiogram graph, people to the people who can't hear when the higher pitches, those are your consonant sounds like I mentioned. So noise is a low pitch phenomenon. So when patients have a very typical age-related hearing loss, you're going to be able to hear well in the lower pitches, which is also the noise, and you're going to be missing those higher pitches. So patients hear all that noise because they have low pitch good hearing, but then they're missing all those consonant sounds. So that's why it's harder for you to hear in background noise, because you're hearing all the noise. You might hear what a patient or someone that is saying, but you don't know exactly what they are saying. And that's because you're missing all those consonant sounds or those higher pitches. So there are many different types and causes of hearing loss. Most typical age-related hearing loss is what we call sensorineural hearing loss. It's damage to the inner ear or the nerve pathways. Very typical, just age-related. You can have toxicity from drugs. A lot of chemotherapy drugs will cause a little bit of damage to the ears. Genetics plays a big part, and of course noise exposure, so wear your hearing protection. Conductive hearing loss is when your nerve is actually okay, but the conduction of sound, so somewhere from the outer or the middle ear is causing some sort of hearing loss. It's not efficiently conducted to the nerve. So you could have an earwax problem, you could have a hole in your eardrum, ear infections, that sort of thing that just don't that hurt the way that the conduction of sound is. And then a mixed hearing loss is the combination of the two. So if you're noticing any hearing loss, call us today and book your appointment. We do a full audiological evaluation. We do air conduction, bone conduction to determine the type of hearing loss. And then we come back to our offices and talk very extensively about your hearing loss and options for you. So have a great day.